We are taking effort to make all these things for y'all. So please y'all also make an effort to like and press the bell icon and comment if you really liked it.
Future Nurse Standards of Proficiency for Registered Nurses. Introduction. The Nursing and Midwifery Council, that is NMC, has a duty to review the standards of proficiency it sets for the professions it registers on regular basis to ensure that standards remain contemporary and fit for the purpose in order to protect the public. So this NMC, its duty is to review the standards, that is whatever the standards are made, this NMC regulates it, reviews it timely, and the standards are according to the values, and the purpose of this standard is to protect the public. Yeah. And they should receive a proper care. So these standards are made by NMC. In reviewing the standards, we have taken into account that the changes that are taking place in society and healthcare whenever they are trying to review it. Review is nothing but checking, improvising wherever necessary, making the changes which are necessary. So this changes according to the society, it keeps on changing according to the health care, it keeps on changing, and the implications this have for registered nurses of future in terms of their role, knowledge and skill requirements. So according to the society, according to the changing scenarios, whatever skills and knowledge the nurse should have, all is reviewed and checked by NMC, and accordingly the standards are made. The proficiency in this document therefore specify the knowledge and skills that registered nurse must demonstrate when caring for people of all ages and across all care settings. So these nurses, whether they are taking care of an individual in a group setting, on an individual level, or in any particular manner, if they are taking care of the public, what should be what knowledge do they should have, what skills they should have, what are the requirements, all this document demonstrates. You can see what they should have, everything is written over here. They reflect what public can expect nurses to know and be able to do in order to deliver safe, compassionate and effective nursing care. This document, it involves or it includes everything what a patient should expect from the nurse while giving care. How compassionate they should be, how passionate, compassionate, safe the environment should be, how should they take care in a most effective manner. Everything is included in this. They also provide a benchmark for nurses from European Economic Area, European Union and overseas wishing to join UK register. So these nurses, they can be from any place of the world, but if they are working in UK and if they are registered under UK NMC, then they should have a proper standard according to NMC. And this NMC, it sets a benchmark for them. There is a benchmark, what they should be doing, what they should not be doing, how they can do it, how they should not do it, everything is mentioned. As well as for those who plan to return to practice after a period of absence. So these standards, they are not only helpful for the newcomers or the ones who are going to join, but it is also important for the nurses who had taken some they have taken a gap, or they are coming back after a time, after a period of absence. They were not working with UK for some time and then they are back. So they have these past nurses, these old nurses, the experienced one, they also should refer to these standards and work accordingly. The role of the nurses in 21st century. Registered nurses play a vital role in providing, leading and coordinating care that is compassionate, evidence-based and person-centered. So what is the role of nurse in 21st century? They have to provide that whatever care, whatever need the patient has, the public has, they have to provide the care accordingly. They have to do the leadership quality when working. They also have to coordinate. We work as a healthcare team, so they should coordinate accordingly so that the patient receives the best. And the care what they are giving, it should be compassionate, evidence based. They should not just give care according to their own knowledge, but they should see the evidence. Like whenever you are treating any person, the medications you are giving, you should just not randomly do it. You should have some evidence to give that medication or to give that treatment. And it should be person centered. Every individual is different, their needs are different, their personalities are different, so you should be working accordingly. They are accountable for their own actions and must be able to work autonomously or as an equal partner with a range of other professionals and in interdisciplinary teams. Whatever actions are taken by nurses or nursing associates or midwives, they are responsible for the work they do. Yeah, so you should be able to take accountability of the work or actions you are doing, and you should also be able to work autonomously and also as an team. Also you should be able to work in both the scenarios. You should show that you can work. You should be able to work with other range of other professionals in an interdisciplinary teams. You should coordinate properly. In order to respond to the impact and demands of professional nursing practice, they must be emotionally intelligent and resilient individuals who are able to manage their own personal health and well-being and know when and how to assess support. When you are working in such kind of settings, you should be sensitive. You should be able to make necessary changes. You should be intelligent enough, emotionally intelligent enough, so that you understand what the patient is going through, what the patient wants. And you should be able to manage your personal health as well, because if your personal health is not good, it can hamper again the public and also the services what you render. You should be able to access for support also. Registered nurses make an important contribution to promotion of health, health protection and prevention of ill health. Looking at you and your health, the patients and the public should be aware of healthy health, or it should reflect in you. Your health should be reflecting them, and it should work as a promotion of health. You should protect your health and prevention of ill health also. Prevention is nothing but before anything happens, taking proper measures. Yeah, so you should be healthy by yourself too, so that you can provide proper health to others. They do this by empowering people, communities and population to exercise choice, take control of their own health decisions and behaviors, and by supporting people to manage their own care where possible. You should be able to demonstrate how the public can take care of themselves, how they can prevent any health disease, how they can do a exercise, how they can whatever healthy things, how they can exercise those healthy things in their life. Yeah, you would be able to manage it. Registered nurses provide leadership in delivering care for people of all ages and from different background, cultures and belief. You should never discriminate. You should treat individual as an individual. You should not change your behavior according to their age or according to their background, according to their culture, difference in the culture or beliefs. The care should be provided in the same manner to everyone with that much of compassion. They provide nursing care for people who have complex mental, physical, cognitive, and behavior care needs, those living with dementia, the elderly, and for people at the end of their life. We provide care for everyone, whether they are mentally unstable, physically, there are some behavior care needed, or people, elderly people, or the people with dementia, and some are who are at the end of their life. So you should be compassionate. You should know how to talk to them, how care can be given to them, how compassionate you can be. These are the vulnerable people, yeah, in different aspects. They must be able to care for people in their own home, in their community or hospital, or in any healthcare setting where their needs are supported and managed. These nurses should help their own people, community, because we are working in a profession which is noble. So that should be demonstrated everywhere, wherever the setting is, in hospital, in any healthcare setting, wherever the support is needed, we should be able to do it. They work in the context of continual change, challenging environment, different models of care delivery, shifting demographics, innovation, and rapidly evolving technologies. We see around us the settings keep on changing, environment keeps on changing. There are different things, external things which affect the setting. So we should be able to cope up with changing surrounding, changing, challenging things around us, technologies. We should be able to cope up and work accordingly. Increasing integration of health and social care services will require registered nurses to negotiate boundaries and play a proactive role in interdisciplinary teams. So as we can see, the health and social care services nowadays, people are aware of it. So accordingly, we should also be proactive, confident enough to work in the setting. The confidence and ability to think critically, apply knowledge and skills, and provide expert, evidence-based direct nursing care therefore lies at the center of all registered nursing practice. The nurse should be confident enough. She should be able to think critically in different scenarios. She should be able to apply her knowledge and skills at right time, provide expert knowledge, evidence-based work should be there, direct nursing care, everything should be followed.